Curbing opioid epidemics is an issue that probably involves many different factors. Part of it actually comes back to us as physicians. Years ago, the AMA was pushing the fact that we need to treat pain. And we basically, pain is perception for most patients, and we basically aggressively treated these pain, the pain that these patients were having. And as such, we basically introduced more opiates into our society and our civilization. And when compared to other industrialized countries, we use opiates significantly higher than any other country in this world. So any regulation that allows us to curtail some of the uses and abuses of opiates, I think is welcome. There are certain drugs that are not needed right now, and changing the formulation such as this drug so that it is now injectable, and I don't say that's their intent, but that is the use. So I don't have an issue with the FDA imposing some restrictions on medications that may or may not be that helpful. We talk about how difficult it is on certain days. The volume can be significant, the acuity can be significant, and how best to deal with that on a particular day. People deal with stresses differently, and trying to sometimes to get to the end of your shift is difficult for some, and it's a daily task that we have to best figure out. I mean, we basically try to be supportive of each other, and when there's issues, I have a great team, and the team is excellent at being supportive and working out issues that may develop throughout the day. So between my two associates and the nursing director and the nurse manager and the administrative personnel within my department, we tend to be able to deal with most issues on any given day. The next issue that tends to crop up most days is anything with computers, IT issues, and those are difficult to deal with because they're out of our scope, and yet we still have to deliver our care. So between the personnel, the IT, and the patient load, it makes for an interesting day in the emergency department.